adherence of intravitreal anti-VEGF therapy and obstacle to the cure. Over to you.
Good afternoon, everyone. I am going to present on reason for non-adherence to intravitreal anti-VEGF therapy. I have no financial disclosure and patient consent have been obtained. Introduction. Oculovascular diseases are among the leading causes of visual impairment and blindness worldwide. Diabetic retinopathy, diabetic macular edema, age-related macular degeneration, and retinal vein occlusion are the most prevalent oculovascular disorders. Anti-VEGFs have an important role in treating common vision-threatening retinal diseases, and multiple studies have demonstrated the efficacy of intravitreal anti-VEGF injection for the management of these diseases. On the other hand, anti-VEGF injections need to be repeated due to their short-term efficacy. Aim to determine reasons for non-compliance to intravitreal anti-VEGF therapy among patients of a tertiary care center. Material and methods. A retrospective study was done on patients attending a tertiary care center who were initiated on intravitreal anti-VEGF therapy between May and October 2022. Data regarding the type of injection, number of injections, its indication, scheduled follow-up, missed visits, and reason for discontinuation of treatment was obtained from hospital records. Result: 76 patients were recruited in the study, 29 males, 47 females, mean age 51 year, 31% had CRVO, 53% diabetic macular edema, 16% had ARMD, and a large number of patients, 44, that is 58%, had lost to follow-up. This is pie chart showing reason for non-compliance. The most common reason being non-affordability, 43%, followed by dissatisfaction, which constituted 20% reason, followed by travel difficulty, which constituted 16%, comorbidity and negligence 7%, fear 5%, and discomfort 2%. This is the bar chart showing the number of patients who have left treatment because of various reasons, the most common being non-affordability. Conclusion: the most prominent reason for refusing further treatment was non-affordability, 43%, n is equal to 19, followed by dissatisfaction, 20%, n is equal to 9. Other reasons were travel inconvenience, comorbidity, negligence, fear, and discomfort. A significant number of patients, that is 58%, had left treatment in between. So the factors involved in non-compliance need to be addressed for better treatment outcome. These are references. Thank you.
Before we go for the discussion, can we have Dr. Smriti Chaudhary? Is she here? Here. Dr. Manisha, it's a very nice study. In fact, this is the need of the hour. It is well thought out study. Only thing is, if it were not to be a retrospective, it were to be a prospective. Because what happens in the retrospective, you don't tend to document the exact cause for discontinuation. Lot of details are, and in this kind of study, the devil lies in the details. So you need to be specifically noting down after like how many doses the patient missed it, and what was the type of anti-VEGF, and who had counseled them. Is it the doctor or the counselor? Because these are the studies which can actually bring out a lot of light on the practice space. Like you can give a lot of guidelines. Like, okay, these many patients were counseled by the counselors, so they were dropped out. So the counseling should be taken up by the doctors and not the counselors. Or the traveling. If traveling is an issue, then it needs an extra counseling. So if it were to be a prospective study, it could have been a much better study.
Thank you, sir.
Yeah, non-affordability, as you mentioned, is clearly a biggest factor. But coming to dissatisfaction, that might be resulting from the lack of proper counseling and unrealistic expectations from patients.
Yes.
So as are told, it needs to be like to give a better outcome. It has to be a prospective study and all those variables have to be mentioned.
So as you already have an idea of this study, maybe you can now to do a proper protocol, get your IRB, the ethics committee approval, because many of these studies, if you want to publish or present, you need those ethics committee approval things. Okay?
Thank you, sir.